Cognitive Information Processing Theory, or CIP, was created at Florida State University in 1971 to aid students with the process of finding a career, resolving career-related problems, and making career choices, a theory based on Aaron Beck's cognitive theory. CIP categorizes people according to their decision status through a system they call Decision Status Taxonomy. The three main categories of the taxonomy are decided, undecided, and indecisive. A person fits the decisive category if they have committed, publicly or privately, to a specific career. The decisive category is further broken down into subcategories: decided confirmation, decided implementation, and decided conflict avoidance. For a person to be undecided, they have not made a commitment because they lack knowledge. The subcategories are deferred choice, where the person experiences no urgent need to make a decision; developmental, where they need to make a choice but are unable to; and multi-potential, where the person had so many options that they cannot make a decision. The final category is indecisive, where people have a dysfunctional level of anxiety about career decisions. CIP believes the heart of career decisions lie in the way we take in and process information. This part of the theory is laid out in a hierarchical structure called the Pyramid of Information Processing. The three levels are the knowledge domain, or self and occupational, the decision-making domain, which is acquisition of generic information processing and also used to make the decision, and the executive processing domain, also known as metacognitions. The first level, the knowledge domain, highlights the importance of helping clients acquire and apply self-knowledge to occupational decisions. This includes interests, skills, and values. Self-knowledge is acquired based on episodes or experiences and one's interpretations of those experiences. If these interpretations are challenged or reinforced, a person will reconstruct their self-knowledge. The second level is the decision-making domain and stresses that it's important to know what to do with acquired information. When at this level, the client and counselor use the CASVE decision-making model as a problem-solving guide and to teach the client to apply it to a variety of problems. C stands for communication. Internal and external cues indicate that a problem exists. This is a gap between current reality and what they want. A stands for analysis, reflection and information gathering stage. They explore the causes of the problem. S stands for synthesis. This is using the knowledge gained from the stage A to do divergent thinking to brainstorm as many possible solutions, down to a list of realistic options. V stands for valuing. This is the process of choosing from an array of options and identifying priorities and using them to evaluate options. E stands for execution. This is where you implement the decision that you made. The last level of the CIP is the executive processing domain, or metacognitions. It's a regulating and integrative process. It looks at the ways clients think about and affect the nature of their own thinking. There are three types of metacognitions: self-talk, self-awareness, and monitoring and control. Counselors can use CASVE in the three domains within the 7-step delivery sequence to represent the stages of counseling. The first stage is the initial interview. The second stage is the preliminary assessment. The third stage is the definition of problem and analysis of causes. In the fourth stage, counselor and client formulate goals. The fifth stage is the development of an individual learning plan. The sixth stage is the completion of the individual learning plan. In the seventh stage, there's a summative review and generalization. After going through all of these steps, client and counselor make sure they are in agreement about the client's issues, reform goals, and design and implement a new individual learning plan. CIP has been studied with veterans, clients with ADHD, and women, and seems to be effective with those groups. However, CIP is not appropriate for all populations. It has a heavy cognitive focus and may be difficult to understand for some clients. In addition, the focus is heavy on decision-making, so it may not be as effective for someone who has recently been laid off from a career that they love. CIP tends to be a more individualized theory for career decision-making. This can alienate people from more collectivist cultures who believe in a collaborative decision-making process with family and community members. While this theory does touch on outside factors, this is a small portion of the overall theory, and the theory is more concerned with the views of self and opinions of self. CIP was also created with college students in mind. This can make it difficult to implement with older individuals who are looking for new careers or experiencing a life role change. It's possible, but this theory mainly works with people who are looking for a direction or need help with initial decisions, and can be hard to use with people looking to change decisions. The theorists attempt to address this in the use of a taxonomy. This theory is also rather wordy and relies a bit on psychoeducation with the client. A counselor needs to be aware of the education level of the client and match the language to fit the level a client will understand. Otherwise, you could alienate them. CIP can be beneficial in the career decision-making process for many clients. However, it's important to take into consideration cognitive ability, personal fit, and the impact of clients' culture prior to implementing this model.